շատ կարևոր հիվանդության կամ խնդրի մասին եւ շատ կուզեի հայերեն զեկուցեի, բայց քանի որ մասնագիտական զեկուցում է ստիպված կլինեմ անգլերեն զեկուցել եւ համոզված եմ, որ մեր թարգմանիչները շատ բարձր որակի թարգմանություն կանեն եւ եթե ինչ-որ հարցեր լինի անպայման կպատասխանենք. So dear friends and colleagues, I'm Arman Danielyan. I'm a child and adolescent psychiatrist. I'm practicing in Bay Area, but I am from Armenia and I graduated from Yerevan State Medical University. So we're going to be talking about treatment strategies in pediatric attention deficit hyperactivity disorder, and I think Dr. Najarian did a fantastic job talking about the importance of recognizing and treating this highly prevalent condition in youth. But I'd like to just briefly focus on the treatment aspects of this condition. And so hopefully by the end of this presentation, the participant should be able to recognize important findings from major clinical trials of treatment of ADHD in youth, and to understand the impact of untreated ADHD. So there are several treatment options for symptoms of ADHD in youth, but I'll be mostly focusing on the medication management of this condition, partly because if you look at the studies done in the United States and internationally, I think the majority of the studies came up with pretty consistent results showing that medications do seem to outperform other treatment modalities. It sounds like, adding psychotherapy might be a good idea, but psychotherapy by itself doesn't seem to do as a great job as medications, or more specifically psychostimulants. And as you know, there are different types of medications that we commonly use for treatment of ADHD, and there are three kind of major categories. The first one is psychostimulants, which also include two subcategories of methylphenidate and amphetamines. There's also medication called atomoxetine or Strattera, the brand name, which is commonly used as well in kids with ADHD. And especially with younger patients, we often use antihypertensive medications like alpha agonists, which include clonidine and guanfacine. And some studies showed that combining those with psychostimulants seemed to be a very effective approach. There are also some off-label treatment options, which include antidepressant medications and others, but we're not going to be focusing on those as much today. So I'd like to talk to you about one of the studies that was done many years ago, but it's still believed to be a landmark study, and this was done in like 1990s and published in 1999 in the Archives of Journal of Psychiatry. The study is called Multimodal Treatment Study of Children with ADHD, or MTA study, and I think many of you most probably are familiar with this particular study. And so pretty much just to kind of summarize, they looked at about close to 600 kids ages 7 to 9 years old who were diagnosed with ADHD, and the researchers randomized these kids into 4 treatment arms. The first group received treatment with just psychostimulant medication. The second group was psychotherapy. The third group was combination of the medication, the psychostimulants with psychotherapy, and the fourth group was treatment as usual, which is just community intervention with no specific, structured interventions. And let me just go forward. So if you look at the results of the study at 14 months, both the medication group and the combination group seem to improve significantly, and they outperformed behavioral therapy alone or community-based treatment alone. The combination treatment with psychostimulants and psychotherapy was especially useful for kids who had ADHD and anxiety, and as you know, anxiety is a type of condition that responds pretty well to psychotherapy, so there's no surprise that kids with ADHD and comorbid anxiety disorders responded well to combination treatment. Youth who received treatment with combination of psychostimulants and psychotherapy more of those youth went into full remission, and also if you use combination of therapy with medication, those kids seem to require lower doses of the psychostimulant medication, which by the way was methylphenidate in this particular study. So here are the response rates for intervention. So the combination treatment with methylphenidate and psychotherapy showed about 68% response. The medications alone, as you can see, also seem to work pretty well, and about 56% of kids with who received treatment with methylphenidate only responded well. Psychotherapy by itself, although did seem to make some difference, but obviously the numbers are pretty low, and the community comparison, of course, was at a pretty low rate. And this is a graphical representation of response to different treatment modalities, as you can see. And let me just use my pointer here. So the combined treatment is this particular, option here. So on the bottom, as you can see, the average score for the hyperactive impulsive symptoms improved the most in the combined treatment group, followed by the medication treatment group. The therapy and the community interventions didn't seem to do such a great job. The total social skills were shown to be also improving in those who received medications with therapy or the medications alone. And parent-child arguing also seemed to improve significantly. As you know, typically kids argue with adults in general, and especially kids with ADHD often have significant, irritability and anger at home with parents. And youth who received medications with psychotherapy did seem to improve significantly compared to the other groups. The authors also then looked at the results at 8-year follow-up. And interestingly, all patients in general improved over time, and there was little difference between the initial treatment arms and the outcome, at the follow-up. So kids who, let's say, responded well to medications with therapy, they seem to continue responding well to the same interventions at 8-year follow-up. And kids who are responded, for example, to medications alone also did seem to respond well to medications alone. Unfortunately, of course, even those kids who responded well to treatment in general, they still didn't seem to perform as well as the normative population, which is kids without ADHD. And about 30% of children continued to meet criteria for ADHD even with the treatment. So these are the most common side effects which you often see with psychostimulant medications. Again, the most common, and this is based on the data of kids who received treatment with Adderall, the most common side effect is decrease in appetite. As you can see, it also dose dependent, so higher doses cause more decrease in appetite. Also, kids often complain that they can't fall asleep, especially if they take the long-acting or the extended release formulation of this medication. Some other side effects include headaches, abdominal pain, nervousness, and emotional lability or irritability. So this is also another slide showing the impact of stimulants on weight and height. As you can see, both of those variables can be affected by psychostimulant medications, and the severity of the depth of the impact is correlated with duration of treatment and also the dose of the treatment, as you can see, or the dose of the medication used, I meant. There was another interesting study done at Massachusetts General Hospital, which looked at the prevalence of substance use disorder in youth with ADHD who received versus who did not receive treatment. And as you can see, those who received treatment were significantly lower at when looking at the rates of substance use compared to those who haven't received treatment. And I think this is really an important topic to look into, especially for our colleagues in Armenia, because as we know, the rates of especially nicotine and alcohol use are pretty high in Armenia, including younger population, younger people, And I strongly believe that partly that's because many of these kids are struggling with symptoms of ADHD but have never been diagnosed or treated. And if you look at some other data on ADHD and substance use, you will see that relative to normative, comparison groups, children with ADHD have significantly higher rates of delinquency and substance use, and children randomized to intensive behavioral therapy reported less 24-month substance use than other children in the same study. And there was another interesting study done, I believe it was at Harvard, that showed that the sooner you start the treatment for symptoms of ADHD and the longer you maintain kids on treatment with psychostimulant medications, significantly lower are the chances that they will be using any kind of drugs or alcohol or any kind of recreational drugs. Younger, like let's say kids who started treatment at 9 years of age or younger had significantly better outcome. Kids with ADHD also have many comorbid conditions, and this is some data from Biederman's study that was published in Pediatrics years ago, but it's a really good study that showed that kids with, let's say, ADHD who have comorbid major depressive disorder, the rates of MDD are significantly higher in those who receive no treatment with stimulants versus those who do receive treatment, and the same is with anxiety disorders as well as oppositional defiant disorders. And kids who do not receive treatment with psychostimulant medications, they have significantly higher chances of repeating their grades at school. ADHD does impact your brain development, and it is a very biological condition, although some people believe that it's not a serious illness. It is a serious illness. And as you can see from this slide, these are kids with pediatric OCD, which is the blue bar, and then the pediatric ADHD and the pediatric autism spectrum disorder. As you can see, there's a significant impact of ADHD on development of different parts of the brain, like thalamus, putamen, and hippocampus, amygdala, and others. And as you can see, other conditions also impact, but significantly, more significantly, ADHD impacts certain areas of the brain. And the same slide is here, which shows the green line shows the normal kind of brain development, more specifically thickness in the left, middle, and inferior frontal gyrus. And as you can see, kids who receive treatment, which is the blue line, they do seem to kind of be very close to the normative sample. They kind of develop, the brain of those kids develop close to what the normal brain of the kids without ADHD would go through, versus the red line, which is kids who do not receive treatment. Anyways, just to conclude, because we're running out of time, psychostimulant medications are very effective for treatment of symptoms of ADHD in children and adolescents, and untreated ADHD is associated with significant morbidity and mortality. Now, as I mentioned, the most effective treatment for ADHD are psychostimulant medications. It has been proven in many, many studies, and psychostimulants have been approved in the United States since the 1950s. I don't know why, I have no idea why is this the case, but psychostimulants are still not available for use in Armenia, and I think it is a very, very big problem, because I strongly believe that if we could implement use of those medications in Armenia, we would see significant number of kids in our country to improve and to function better, to do better at school, to stay away from drugs and alcohol, and not to engage in high-risk behaviors. I do encourage the state and governmental officials in Armenia, Ministry of Health in Armenia, to really take closer look into what is the issue. How can we, from diaspora or our colleagues in Armenia, help to introduce psychostimulant drugs in Armenia and to really provide proven to be effective treatment for these kids and adolescents. Thank you very much. Thanks for Dr. Najarian again for his great presentation. And if you have any questions, just please contact us.